Welcome to RUMC Connections. My name is Meredith Gaskins, and I'm joined today by Alex Lutz, the VP of Marketing and Public Relations at RUMC, Angela Ciocia, our lead paramedic at RUMC, and James Donnelly, our lead EMT, as well as Dan Ryan, the Director of Advertising here at the Staten Island Advance. Welcome, everybody.
Good morning.
Through RUMC Connections, you will meet the fantastic individuals that make Richmond University Medical Center thrive. We'll also explore the latest medical news and hopefully get you answers to some of your own health-related questions. In 1870, RUMC, when it was then known as St. Vincent's Hospital, started its first horse-drawn ambulance, and the hospital's emergency medical service, or EMS, has been going strong ever since. Today, Richmond University Medical Center has a combined total of 150 emergency medical technicians and paramedics. Last year, these EMTs and paramedics responded to over 28,000 911 calls. RUMC EMS is under the leadership of the FDNY, which oversees the entire New York City 911 system. In today's episode, we'll meet two of our EMS members and learn more about life on an ambulance, as well as what it takes to be an EMT or a paramedic. So Angela has 35 years of experience as an EMT and paramedic at RUMC. Angela became an EMT in the spring of 1981 while in her senior year at Port Richmond High School, my alumni also. She began her employment at RUMC in November of 1987 as a nursing assistant, transferring to EMS in June of 1990. She became a certified paramedic in September 2005 and has been the lead paramedic at RUMC for a little less than a year. James Donnelly has been an EMT since 1987. He started on a volunteer ambulance while attending John Jay College of Criminal Justice. Jim has been lead EMT at RUMC for the last 15 years. So could both of you please explain what the difference is between an EMT and a paramedic?
EMT is 5 months of training, and paramedic is a little bit over a year.
Okay.
Paramedic can give more medications and vary dosages based on the patient's weight or needs, and also there's manual defibrillation and intubation.
You have to
a
be
little more skills.
You have to be an EMT before you become a paramedic. In the past, it was that you had to do a few years on the ambulance and have experience. Now you can go from pretty much from EMT school to paramedic school. As James said, we have more training, we have more equipment, and we're able to give medications and do manual defibrillation.
So when an ambulance pulls up to someone's house, you wouldn't necessarily know who's an EMT, who's a paramedic. Are you guys
the trucks are not marked anymore.
Okay. So how do you determine when you need a paramedic or an EMT when they roll up on the scene?
The 911 operator will make a determination based on what the caller says, and based on their computer dispatch, it will determine whether a BLS unit, basic life support unit, or advanced life support paramedic unit is sent. When we get there, based on what we find, we can always upgrade it or downgrade it to request assistance or to tell the medics they're not needed.
So I guess in those situations, then the ambulances are pretty much set up to meet whoever is driving the bus, so to say.
Yes.
Yeah.
They're set up slightly differently in the back. The paramedic truck carries more equipment. But we can mix and match as needed. We have a pool of spare vehicles, and they can be set up as needed.
So are a paramedic and an EMT on the ambulance together at the same time?
Not in the 911 system.
Okay.
In the privates, they'll work one EMT driving with the paramedic. But in the 911 system, it has to be two paramedics on a paramedic unit, two EMTs on an EMT unit.
Okay, I didn't know that. Interesting.
And when is a decision made on who should be there, or if additional assistance is needed?
The 911 caller will make the initial decision how to dispatch the call, and then once we get there, we can upgrade or downgrade as needed.
And I mean, I see ambulances all over Staten Island. I mean, all over wherever you go. I mean, do you guys have predestined points that you kind of station yourself at?
The fire department assigns us a cross street location. We have to be within 3 blocks of that cross street.
I see.
We don't get a firehouse or a station to sit in. We sit on the corner.
So you're sitting in the bus for the whole shift.
The truck runs 24 hours a day.
Wow.
Because we have to maintain the temperature in the patient compartment, and we have to maintain the computer and the dispatch radio, and that requires a fair bit of power. So the truck runs unless it's being taken out of service for oil changes. They get the oil changed once every 2 weeks.
That's crazy.
Yeah.
Otherwise it runs 24/7.
So even though you're in
There's-
that station, you truly never have 2 days that are alike.
No.
Never. Every day is a new, every day is a new adventure.
So walk us through that. You're sitting at a station, wherever it may be, and a call comes through. You get that. How do you? What's that time frame? What's that like from the moment you get the call? Now you're rolling to the scene. I assume you're getting information. How do you get ready? Because you're going into a situation that you're only hearing what it might be. You just really don't know what it is.
Right. The call will come up with basic information. If it's a 911 call, it'll come up with whatever they'll type it in the screen. We have a computer screen in the truck. Calls that come in from police or fire tend to come with almost no information, just a call type. Run through your scenarios of what you might need. We have one basic bag that we carry on every call and a defibrillator. And we have extra bags that we'll need for pediatric cases or major trauma or stuff like that.
And then with the paramedics, if we're assigned, again, as it says on the computer, what we're expecting, but we walk in with our paramedic bag, which has our meds and our intubation, our airway devices, an oxygen bag, same for oxygen, and usually a carrying device.
But I imagine even with all the experience you guys have had in the same, I'll say, type of call, no two heart attacks are the same. No. Yeah, exactly. So everything has still got an element of the unknown that you're dealing with.
And you walk in and you do your basically 30-second evaluation of is this something I can handle or is this something that I need help for?
And is it
from the EMT side, you need to know if you're going to need medics.
right? And do you find that most of the calls that you respond to do require transportation to the hospital, or not?
For the paramedics, they transport probably about 80% of the calls they go
Probably.
to. For the
At
EMTs,
least.
probably about 60 to 70%.
Wow.
And
We
then
do a
you-
lot more RMAs. We just refuse medical aid.
Then you go right back to that same station?
Same
that
cross street,
3-block
yeah.
radius?
Yep.
Incredible.
And how do you then coordinate with your colleagues in the emergency department if you are going to the hospital?
You hand off to whoever the charge nurse is.
Okay.
And they'll take their report, type up their nurse's notes, and assign the patient to a bed with a nurse.
And also, depending upon the call type, we sometimes have to give notification to the hospital that we're going to, whether it be over the EMS radio or our cell phone.
Okay.
I feel more comfortable calling RUMC directly. This way I talk to my nurse or doctor. I know who I'm speaking to, whether I'm coming in with a acute MI, heart attack, whether I'm coming in with a stroke, or if I'm coming in with a trauma note. These are some of the categories that we have to or are expected to give notifications on. This way the ER is prepared for when we get there, what they're going to need, whether they're going to need the trauma team, the cardiac team, the stroke team.
And how do you guys stay focused with such an element of the unknown? I mean, I have to imagine you're not only walking into a situation where you've been told it's possibly a heart attack, but you don't know, but there's other factors, the layout of the house. I mean, how the other family members are.
Your head has to be on a swivel at all times.
It's a good way of putting it.
Because you never know what you're walking into, as Jimmy said. You do your scene survey, and because one thing I look at, where's my exit and what my crowd is like. Because we're seeing people on there that may be the worst day of their lives, and they're not meaning to be aggressive sometimes, but they're all upset. And of course, being upset sometimes makes people a little aggressive sometimes.
Right.
As you know, we had a EMT shot in the line of duty last year
Yes.
on what was a routine call,
Right.
routine sick, intoxicated,
Right.
and he looked up and the guy had a gun.
Right. And thankfully, he's okay. He's recovering, which is great. We wish him well.
Unfortunately, I was on
Who are you?
working the truck, so I actually had to take care of my coworker, who I know well. And up until getting and seeing the person, I didn't know how bad it was going to be.
And I guess that's a factor of the job that you can't be prepared for that. Something like, hearing that. I mean, that was one of my questions I was going to ask, is that I imagine there's always that thought. I mean, Staten Island is a very small place. You hear an address you got to go to, and that's my neighbor. I know that address. That's something you have to kind of, I guess, put the personal side and be the professional first, I guess.
Yeah.
And I can imagine that it's tremendously important to have a good partner in a job like this? How often do you rely on your partner who's
Always.
Yeah.
Always. And a good partner or a not great partner can make or break your day, your mood, your shift, and your calls. I'm very lucky. Most of my partners, I've been doing this a very long time, I've had good experience with most of my partners. I know that, or even if it's ALS, advanced life support and basic life support, I know that if I'm in the back of the ambulance and Jimmy's driving, I'm going to get there safe. I know he's prepared to get me there safely. And that's a big part, because now I'm relying on him on my safety and my patient's safety.
What's your shift rotation? How many days are you on? How many days are you off?
Medics do 312s, EMTs do 5/8s. And the schedule is completely variable.
Yeah.
It starts out with you're on 5 of the same shift, and then people do mutuals because they want to do a shorter week. They'll do a double 16-hour shift one day and then have a shorter week.
For a very long time, I worked Wednesday night, Thursday night, Friday night, overnights, 12-hour shifts at RUMC. And I work part-time at a different hospital. I work every Saturday night a 12-hour shift. Now that I'm the lead medic, I do my Wednesday night on the ambulance, definitely. But I also do other plus I do other days in the office. Or if I have to, if I have no paramedic to do the shift, I have been known to pick up the shift.
And being EMTs and paramedics for so long, you've seen, I'm sure, a lot of changes in your field, from the design of the vehicles to technology. How has that helped your job as technology has advanced?
The single biggest technology, not necessarily medical, it's GPS. I started when we were on paper maps, and I had to learn my area and learn it well. Now, everybody can get to calls as fast as I can because they have the GPS. They just plug in the number and follow GPS. That helps the new people a lot, getting locations.
Yes, and I think a medical advance is the AED. Paramedics have, as I said, manual defibrillators. So we had that big machine that we can defibrillate someone. But the addition to automatic defibrillators being everywhere, because that really does increase and improve the quality of life immensely, because civilians know how to do AEDs, and that 5 minutes it takes me to get to a job, you'll be there right there because your neighbor's there. So it does help immensely.
And then how do you maneuver safely driving an ambulance? I know traffic can be crazy.
It takes practice. The vehicle's not that different from an SUV. It's just heavier.
Yeah.
It's wider. And as long as you take that into account, you get used to it. I've been doing it for so many years now. I do it without even thinking about it. It's getting harder with new people because they have less experience driving heavy vehicles or driving vehicles with four-wheel drive. They need more training, but it's manageable.
But everybody in the ambulance is trained to drive as well as...
They're all trained to drive. So we have 2 people that are under the age restriction for our insurance. And we have a few people that have had mishaps and are restricted.
I'd almost be more worried about the other people on the road.
Right.
Oh, yeah.
I feel that it's been overcrowded since the pandemic. Like there's more vehicles on the road for sure, but there's a lack of consideration often I see when we see
with ambulances,
an ambulance coming.
Yeah.
I can't understand.
People will get out of the way of the police car because they know they're going to get a ticket if they don't. They get out of the way of the fire truck because the fire truck is coming and they don't want to get hit.
Right.
And the ambulance, they pay no mind.
Often.
Right.
And then, some people, I know many years ago when I learned to drive, you're supposed to go to the right. People panic and go to the left, stop in the middle, and you're never quite sure what they're going to do. You can't anticipate what someone else is going to do. I had a few years ago, a patient, yes, the person, did pull over. And I was about to make a right turn. Well, she looked over her shoulder to see if anybody else was coming, and she started to go. Unfortunately, I had slowed down to make that right turn, and she rear-ended me.
So I guess, we've asked this question of some of the physicians that we've had on the show, and they've all answered pretty much the same way, and I'm thinking it's probably the same for you. The techniques, the procedures that you guys do in the field are probably changing every so often or constantly. How do you stay up on what you need to know in situations?
We, as EMTs and paramedics, both have to go for refresher training every 3 years.
Okay.
And RUMSCO, which is the Regional Emergency Medical Council, they have protocol updates every year. So our protocols from September of 2022 are now different now from January of 2023. Slight changes, but we have to update on our protocol updates with our CMEs through Dr. Basilius, our medical director, or just overall online updates.
So you mentioned earlier that when you arrive at the scene and you come in the door for the first time, so to say, you have there's a procedure, a very quick overview of like a check. What exactly do you do?
You introduce yourself to the patient, talk to them. What's the problem? And while you're doing that, you're also observing them, and you can observe them for obvious shortness of breath or stuff like that. You're going to do a quick set of vitals. I'll go grab a pulse real quick. I can tell from the pulse, sort of guess where their blood pressure is going to be if I'm going to need paramedics or if I'm not going to need paramedics.
And that's all in the first...
All 30 seconds to a minute.
Wow. So I imagine you're also, I mean, to me, if I had to call 911 to come in and do something for me and you show up at my door, there's a sense of relief. You're here. So you're also not only the paramedic or the EMT, but you're also kind of this friendly face. So how do you calm, if I think I'm having a heart attack, I'm probably just, how do you calm a person? How do you interact with that patient?
Just speak to them calmly and just keep repeating. We get a lot of people with anxiety attacks or hyperventilation, and it's just, we gotta tell them, just calm, relax, picture yourself on the beach, just breathe, and we'll take care of the rest.
Like you said, how no two calls are the same or no day is alike. What are some of the challenges of being an EMT, EMS worker, I should say?
The biggest challenge is the increasing weight of the patients.
Yes.
Really?
You've seen more obesity,
Yeah.
and
Are the
It's-
ambulances equipped for like bariatric
we
patients?
have now powered stretchers that
Okay.
we've only had for like about the past 2 years. But other than that, everything is manual lift.
Okay.
Which ties into the last episodes we did. We actually had Dr. Barkin here who was talking about weight loss surgery, and one of the first questions Meredith asked him was, how as a society are we doing? And he came right out and said that as far as a society, we are not doing well when it comes to that. And when you think of weight gain, you think of the health risks to yourself. You don't think of the risk that someone coming to help you may be hindered by the fact that your obesity is going to hinder them from doing their job. So it's an interesting take I hadn't thought of.
All too frequently, we have to call for, like as a paramedic, we have to call for either basic life support backup if I need medical help. I need to help me to drive into the hospital, but I need fire department help to get my patient in or out of the house. If someone's in the basement and my stair chair, which is what we carry people up and down stairs with, if they don't fit in that stair chair and we have to get them from the basement, I need help. Or downstairs, upstairs,
The chair we use is rated to 300 pounds.
Oh.
and quite a few of our patients are more than that.
The fire department has a Stokes basket that's rated to 600 pounds. But it needs 4 people to carry it.
Wow.
So
you mentioned the fire department. So when you roll up on a scene and it's a scene where there's NYPD, FDNY, and now you guys are the scene, how do you coordinate with the other agencies? Does it one agency takes control of the situation?
We are in control of the patient care. Anything criminal, police are in charge, and anything rescue or fire related, fire is in charge. All the engine companies are trained to CFR level, certified first responder. It's a step below EMT. Some of them are also EMTs though. So they're the ones we interact with more so than the ladder and rescue companies.
I see.
And the police do what they got to do, especially with psych patients.
Right.
So what's the age when you could become an EMT?
The age now is down to 17. You can start the class at 16 because they have trouble recruiting upstate, so they lowered the age.
Wow.
The age to be hired at RUMC is 21 because we have a restriction on driving for the younger people.
I'm assuming in your careers, you've responded to mass casualty situations, like say maybe the ferry crash,
9/11.
9/11. How do you coordinate you have so many ambulances, so many EMTs, so many paramedics rushing to the scene. How do you coordinate that, what looks like controlled chaos?
It is controlled chaos. 9/11 especially was absolute chaos because prior to 9/11, the hospital ambulances were not really trained on MCIs and triage. The fire department did their thing.
And MCI is Mass Casualty
Mass
Institute.
yeah. The fire department did their thing. They figured that no matter where the incident happened, there would be at least one fire department ambulance there, and they would take over triage and sorting. And then 9/11 happened, and because of the area is New York Downtown Hospital, St. Vincent's, the old Greenwich campus, it was a lot of hospital ambulances, and they didn't do triage. They grabbed the first 10 people they could find, and they transported. It wasn't nice and neat the way we tried to do things, but it worked out in the long run because everybody they transported was not there when the towers came down. Most of the EMTs that were killed at the triage area at the fire department because they had set it up underneath the pedestrian bridge because they figured the pedestrian bridge would protect them from falling glass, and no one expected the building to come down.
I see. And then I assume, as we've seen all across the city, changes came about in the aftermath of
now
9/11.
there's much more training for the hospital units for mass casualties and for triage and how to fit into the fire department's triage system.
And that, I assume, was then in place for the ferry crashes that we
Yes.
had here. So I see.
Yeah.
I see.
And it's used rather often at fire scenes because there's a section with logistics, there's a section who's command control. This way the fire department firefighters know that we're there and where we're located if they need us. And they're the ones that coordinate who goes, which ambulance or which crew goes where.
And we've touched on a lot of different things that could be like negatives or scary, but you guys get to help people save lives on a regular basis. So that's got to be very rewarding.
Yeah.
What made you want to be an EMT or a paramedic?
I originally wanted to be a police officer. I couldn't pass the medical.
Yeah.
So EMS was second choice.
I don't know, it's been so long. I had a few, it's not nice to laugh at me.
Sorry.
Unfortunately, when I was in my mid-teens, I had two very traumatic incidents that I needed EMS, not that I was injured, but I had family members or close friends that EMS arrived. And though they didn't succeed in either of those cases, they made a big impression on me. So I went to my first volunteer ambulance meeting when I was 16. I joined the youth squad at Volunteer Heart, and I got into EMT school when I was 17 years old. And I graduated, as I said, mid of my senior year, and I've been on an ambulance ever since. I've gone to nursing school twice and just didn't fit well. And here I am, all these years later, still on an ambulance.
Wow.
That's great. It's definitely a long career. What are some tips or advice that you would share with somebody who is considering an EMS career?
Well, we're both instructors.
Yeah. So what do you tell them?
I've been doing it so long. You have to like your job.
Yes.
You have to be patient. You have to be kind to yourself, because if you don't take care of yourself, you're not going to be able to take care of anybody else. And we see that more and more now after 9/11, and especially after COVID. Everybody's been so touched. No one was unscathed by these events, anybody.
Yeah.
And it takes a toll on our physically and our mentally and our emotionally. And some things you just can't, you do the best you can.
Do you find as instructors that there is a dropout rate? Like, it's one thing to say I want to be an EMT.
It's not so much a dropout rate is they come in with the expectation that they're going to get promoted to something like they go into the fire department or they go into the police department. They're doing EMS as a stepping stone.
I see.
Okay.
I tell all the students when I have them on the truck that if you decide you love EMS, go join the fire department EMS, because you do it full time and the retirement down the road is much better than in the private sector. If you want to do something medical, but not necessarily EMS, then you come work for the hospitals, because you can be part-time, you can be per diem, is a much more flexible schedule while you're doing further school.
And have you noticed? We had Dr. Harris on a while back, and he was talking about medical school is becoming. He's seeing more and more surgeons are women. Are you seeing that in EMS as your instructors? Are you seeing it's
About 50-50.
It is.
Yeah.
Many years ago, there were many less females in EMT school, but now, as Jimmy said, it's about 50-50. Seeing a lot less students too, though, now. I know the school I teach for, we used to have 35, 45 applicants, and now they're in the low 20s. I don't know whether people are getting disillusioned or just there's more job opportunities and they're just not coming to EMS.
And what's been so rewarding working for RUMC for so long?
I like helping my community. I mean, it's, as you said, it's difficult to go when you know somebody. No, it's someone you know, but it's rewarding when it's a win that you help someone you know or a friend of a friend.
Yeah, of course. Well, I would like to thank you, Angela and James, for joining us today and for your dedication to the community and all that
Absolutely.
you do to keep us safe. Thank you.
Oh, you're welcome.
Okay.